here. Welcome to our workshop. Welcome to Your Pregnant Body. I am so excited that you guys are here with me. I'm Dr. Allison, owner of Body Motion Physical Therapy, and I'm joined here with Devin and also Isabel, and they work with me here at the office along with Dr. Riley and Dr. Victoria, but they are currently not on this webinar with us. So we are located in downtown Edmonds, Washington, and I'm currently 24 weeks pregnant as well. So I'm excited to be joined with other pregnant moms. This is my third pregnancy, and I've been working with pregnant moms for many years. So excited you're here and to teach you guys all about your body, your pelvic floor, and really how to prep for birth, which is going to accelerate any healing postpartum. So what you're doing for yourself today is absolutely amazing. And I just wish I could shout this from the rooftops so everybody could hear. And thank you for being here. Cool. So like I said, I'm Dr. Allison, and we're located here in downtown Edmonds, and Dr. Riley and Dr. Victoria are also the other doctors in the office here. Before we dive in, this is just a little bit, you've probably received an email from us already or a phone call, and we offer anyone who attends this a free discovery visit. So it's a free consultation really to talk about everything you're experiencing personally with the doctor, where you're at in your pregnancy, what you're hoping for delivery, and really what your plan is. So that is up for grabs there. Isabel will be in touch with you if you're interested in scheduling that. Cool. And anyone who schedules that also gets a free copy of my book, which is called Restore Your Body After Kids. And a lot of people asked in the questions that we sent out about exercise postpartum. And I have an exercise guide in this book. And a lot of this, if you start prenatally, so there's a whole exercise chapter. So it's called Postpartum Exercise Return, but there's a whole chapter on this. And if you start this prenatally, which is totally safe to do, a lot of them, some of them won't feel good on your body, and so you wouldn't do them. But if you start those prenatally, those can help accelerate the healing because you're going to start activating your little core muscles that are really important to start activating postpartum and like kind of the start to recovery. And so there's that guide for you too. And I'll probably touch on that a little bit as it's in one of the slides. So we're going to get going here. I'm going to talk about some general posture and all this fun stuff. Anatomy changes during pregnancy, what you need to know about your core body mechanics, and really talk about pelvic floor preparation for birth. This is pretty much my passion. A lot of people can teach you posture and body mechanics and exercise, but there's just not a lot of people out there that are helping really prepare pregnant people for delivery. And that is really important because it can prevent not just tears, it can prevent C-sections, it can help reduce healing time. And so I'm going to get into that a little bit more. And that'll be really good information for you to have. And then we'll talk about some birth prep exercises you can start today, just some daily rituals to work into your routine. And then we'll also talk about some normal postpartum healing times and exercises. Cool. Okay, so this is like I'm going to say boring part, but whatever. This is the hard part. It's so funny because I teach people this like all day long, right? And then I find myself like I'm sitting here slouched over giving this webinar. So I feel you. But to the best we can, we want to have good posture because as we get bigger, our center of gravity is going to change. So good posture. We're going to talk about that here. Let's see. If I lift it up here, I'm going to have to ditch the headphones for a second. Nope, because you won't be able to hear me. Let's try. Can you hear me? Just a thumbs up, Devin, would work. Perfect. Okay. So good posture for pregnancy is for your head, as our chest and bellies get bigger, our heads start to go forward. So one of the things you want to do is bring your head over your body. So your ear lines up with your shoulder to the best you can. That kind of gives you a double chin posture, which isn't super sexy, but is very helpful for the neck, is going to help take away tension and strain on the neck. A couple people had written in that this is like their biggest problem pregnancy wise. And I have to say, in the beginning of my first and second trimester, this was my problem too. So I just had to be so conscious of making sure my head was over my shoulders. And if you are having neck pain, one little trick you can do to kick on your neck actually has like little stabilizing muscles that are part of the core. And one thing you can do to kick those muscles on is to press your tongue like this behind your front top teeth, like this. And that helps kick on your stabilizers and it will take some of that pain and pressure off your neck. So if you're in this position, bring your head back, kick on those little muscles. If you can feel them by pressing your tongue behind those top teeth. And that's just a good way to kick those on. You don't have to keep doing that. But especially if you're having neck pain, play around. So that's the first thing. The second thing is a lot of times our shoulders become hunched over or we kind of like sway backwards. The goal for good posture in the mid back is to imagine if this shoulder blade and this shoulder blade, you'd want this one to drop in to this back pocket over here. So if I was wearing jeans, I'd want this shoulder to connect to this butt and this shoulder to connect to that butt. So you're pulling your shoulder blades down in an X fashion, but you're not leaving your head out to dry here. You're pulling your head back too. So that's just a little bit for that. For the lumbar spine, we want to avoid, make my screen a little better. We want to avoid like a severe lordosis like this. And you want to pull the baby in with your muscles, which we'll talk about in just a little bit, and create more of a neutral spine. So you're not sitting here like hanging on your ligaments. You're pulling baby in and keeping things stacked up. And that's the same for the pelvic tilt. The other thing that you'll find is your knees might go into like a locked or hyperextended position to help get you some stability. And you really want to avoid hyperextending your knees and standing on your feet with hyperextended knees. It's going to put a lot of pressure on your joints. So coming back to my headphones, and let's go to the next page here. So don't worry about what all these are saying. Actually, before I hop into that, does anyone have questions about posture? Type it into the chat if you'd like. Cool. So this is perfect here. As you get bigger, you lose space in your diaphragm. And so your vital capacity of your lungs gets less. So you might feel out of breath often. So I'm going to be pausing here just to take some breaths because you might experience the same thing. Cool. We'll go over laying posture. I'm going to go over some body mechanics in a separate slide here. So I will do that in a second here. All right. So generally what happens, muscles get longer during pregnancy. Our abs get lengthened. And so our core is just weaker in general because we lose our natural pressure that we have inside the core. And so belly gets long, all the muscles get longer. The diaphragm also gets weaker because the ribs flare out. The diaphragm is going to be one of the most important muscles that you're going to want to keep strong during your entire pregnancy and keep working because it's going to help you push the baby out and it's going to help you labor. And so even though it's not like a core muscle that you can go do 100 crunches for, it's a really important muscle to be able to keep active throughout your entire pregnancy. And so one of my favorite daily rituals to keep the diaphragm active is to put your hands on your belly. And you would take a nice deep breath into your hands. So your deep breath into hands, let it go. You might feel like you don't have as much space for your belly to expand, and that's okay. You're just going to do what you can and not force the air anywhere. You're just inhaling, making the air come down deep. The reason this is so important is because your diaphragm, which sits under your ribs in this kind of dome fashion, it mimics what the pelvic floor is doing. So this is your pelvic floor. I'll go through the anatomy in just a little bit. But if the diaphragm relaxes, so if the diaphragm contracts on the inhale, so you breathe in, diaphragm drops down into belly, your pelvic floor also should drop down to the floor. So this is important because when a baby comes out of our body, we want that opening effect. Most people, 99% of the pregnant people that we work with have actually very tight and taut pelvic floors, and they don't get that opening with their breath. And that's why they can have long pushing periods, pain tears, or unable to evacuate the baby. So it's really important to keep that diaphragm moving so the pelvic floor can move as well with that diaphragm. And we'll talk about how to feel that in just a minute here when we talk about the pelvic floor. So 5-minute daily ritual is just simply breathing into your diaphragm. And I will connect that to the pelvic floor on the next slide. I briefly mentioned the pelvic floor, but this is your pelvis. So it's like two bones. They're connected at this thing called the pubic symphysis. And I know some people mentioned that they have pain there. And that's definitely really common because you get a 5 to 7 millimeter separation at this joint during pregnancy. And it can go all the way up to 9 millimeters during delivery. So when the baby actually comes through birth canal. And so that's a massive stretch. And it's something that if you're experiencing that, you definitely want to see a pelvic expert PT because that sign of pain can just tell you that there's some dysfunction probably happening inside the pelvic floor. But regardless, whether you feel pain at that joint or not, this is happening. So you are getting separation there. It's really important to just keep that in mind because if you're doing, I'm not going to say like a lot of impact exercises or single leg exercises can start to irritate that joint just because it's so loose. And so you want to modify some of those exercises because they can predispose you to kind of shifting that joint around. So you want to prevent that. So single leg exercises, just be really cautious of. You want to know how to activate your core in order to keep that together, keep it approximated. But we'll talk about some exercises in a bit. So those are the pelvic changes. When this all happens, when the pelvis is loosey-goosey and starting to expand, you'll notice, and this happens right away, just so you guys know, relaxin is released in the body in the first trimester. So around 7-8 weeks, you already have relaxin flowing, 6-7-8 weeks, you have relaxin already flowing and causing major changes inside the pelvis. When that all happens and you have the pelvis kind of loosey-goosey, you get your pelvic floor will tighten up, and it tightens up in order to kind of like keep you glued together, and your butt tightens up to keep your pelvis glued together. If you have a really strong core right from the get-go, a really balanced core, you'll experience less of that. But most of the time, because of the changes in weight, the changes in the joints, we see that everyone tends to have really tight butts and really tight pelvic floors during pregnancy to help them keep glued together. And unfortunately, like that's not necessarily optimal for birth. So a lot of pelvic floor PT is all about opening this pelvic floor, relaxing the pelvic floor, because the natural position of what the pelvic floor should be doing when you're pregnant is elongating with the growth of the baby. But most of the time we don't see that. And that's why seeing a pelvic expert PT and really doing a lot of manual work inside the pelvis and externally can help a ton prepare you for opening and getting the baby out. I'm going to come to the question board here. Cool. So Alyssa asked, I hope I pronounced your name correctly. How about squats? Are those okay if you're lifting weights before? Sounds like just maybe not split squats. Yeah. And honestly, if you've been doing squats are great. Squats are fine. It's all about, if they feel good on your body, keep doing them. Squats are amazing because they're going to help open up the pelvis. And you want to start playing with, when you are squatting, being able to relax and open your pelvic floor or contract your pelvic floor in that squat position. Most women in the US, because we don't squat a ton and we don't hang out in those deep squat positions, it's hard for our pelvic floors to actually relax in those positions. So if you're going to use the squat as a birthing position, you want to make sure that you can really relax your pelvic floor in that position. So hopefully that makes sense. As far as split squats go, Yeah, you just want to be careful. So like if you're doing heavy weights with split squats, then it could be okay for your body specifically because you're used to that. You might go lighter, you might make your stride a little less, so you're not stretching the hip back as much. So you're not getting as much shearing forces through that joint. You just want to be a little bit more cautious with that, especially side lunges. Side lunges are really popular, but that's where I see a lot of people start to get pubic bone irritation. So maybe take it to a side squat and not necessarily a side lunge. Um, cool. Okay, so we talked about that. I'm going to just touch on a couple other muscles here. Let's go to the next. Well, let's talk about. I'll stay here. Okay, so the other abdominal muscles that are really important: obliques, your transverse abdominis, which is this little muscle that goes across the bottom of the belly, actually goes across the whole abdominal wall, and then your rectus abdominis muscle. So this is important because the rectus abdominis oftentimes will split during pregnancy. And that is called a diastasis recti, or people call it mommy tummy, or whatever you want to call it. The medical name is diastasis recti, or diastasis. And with that split, there's actually a lot you can do to prevent that during pregnancy. So the very first thing you want to learn how to do is to activate your transverse abdominis. So if you can lead, so if you're lifting weights, any exercise you're doing, no matter what the exercise is, it becomes tenfold safer if you're activating this muscle. So I'm going to try and show you my body here. Let's see if I can get there. Okay, cool. So here's baby. Okay, so here's my belly button. Here's my pubic bone. If I think about pulling the baby up and in, I am activating my transverse abdominis. If I'm just bracing my abdominal wall and pulling everything in, I'm getting my obliques firing. Okay, so that's the side of my belly. So if I'm just like bracing for a hit, or like someone's going to punch me and I'm bracing for it, or my kid's going to kick me and I brace for it, I'm activating my obliques. If so, this is really important because if you are activating your obliques, you're going to get more of this separation force versus if you lead the movement with activating your TA, which is that. So that looks different in the front too. It's just I'm lifting. Do you see the lift happening instead of the bracing happening? Does anyone follow this? Type into the chat if you're like, yes, I get this, I get this. So these are two different contractions. So you might think that you're using your core, but it's really important that you lead your core movements with activating the transverse abdominis, which is hip to hip. Blah, blah, blah. This bone goes from this hip to this hip. And you can act like you're sewing a needle or a piece of wire from one side to the other and gently tightening it up, but you're just trying to lift your belly with that muscle. When you do this, I just noticed myself, I wanted to clench my butt there. You want to keep your butt relaxed when you do this. So that is contraction of your transverse abdominis muscle. And it is really important, especially as you get bigger. And the body, as you get bigger, that muscle just innately gets weaker, like we talked about with the muscle length earlier. So you want to make sure that you're activating that throughout your entire pregnancy. It's going to support your back, it's going to support your pubic bone, and help take a lot of the stress off your joints. Make sense? Possibly? Type into the chat if you have any questions. I'm happy to answer it. I'm happy to go through that again. But that is extremely important because anyone that we see that can really work on activating their transverse abdominis, they can do a ton to prevent that diastasis or that abdominal split. We also work on it just preventatively. Everyone who comes here, we do make sure that we're addressing other tissue that will help prevent the abdominal split. So there's like part of your, if it splits, what can you do? Physical therapy. Some people split bad enough that surgery is the option that works for them. But as far, we definitely treat diastasis a lot. And you might already be experiencing some of that. And there's a lot you can do to actually heal it during pregnancy too. No, I don't talk about that in the packet. So, but if you want, come for a discovery visit and we'll talk to you about definitely activating that muscle. And then if you're having difficulty, we definitely, this is something we go over in sessions. This muscle, this is a little bit more in detail. I'm not going to go into all the connections, but it does connect to pelvic floor. So it's really important that you can differentiate. And if you have a really tight pelvic floor, you have to make sure that you're not getting even tighter when you activate this muscle. So it's a little bit tricky. Everybody's body's a little different in how this coordinates. But this is good because not if you can activate that transverse abdominis, it also has a ligament on your belly button that goes to your bladder that helps keep your organs a little bit more elevated. So if you're activating it the right way, you're going to help keep your organs in a better position as well and help prevent what we call pelvic organ prolapse. And that is descent of your pelvic organs that can happen with childbirth and delivery. It sounds scary, but there's a lot we can do to prevent that stuff. And especially with helping treat and like improve your pelvic floor wherever it's at now, doing that pre-birth are just leaps and bounds of, it's amazing what that does, because the recovery postpartum tends to be minimal compared to people that don't get this treatment prenatally. So that's why I'm so passionate about it. So now we're going to just talk about a little bit about body mechanics. Yeah, perfect. So we'll talk about these adapting these exercises or these things we do every single day. So the reason I'm going to talk about these is because, like I said in the previous slide, our muscles become weak because they get longer. And when they're weaker and we're not supporting our newly loose joints, we're more susceptible to injury. Pubic bone pain, low back pain, SI pain, the diastasis, all of it. So whenever I am going to demonstrate these like mechanics right now, you have to lead this movement with a TA. So that transverse abdominal contraction. So getting in and out of the car, it's going to depend on if you have an SUV or let's see here. Devin, can you still hear me? Cool. Okay. So make sure you can see me. I can't see myself. So there we go. Okay. So getting in and out of the car. So if this is my car here, one of the things to help protect my pubic bone, is you want to sit in the car first, keep my TA turned on as I bring my legs in the car. And then I'm going to get out of the car the same way. My TA turns on. I'm going to exit the car this way. Now, if you have an SUV, you might want to stand on the lip or the edge and then turn your butt in. You want to avoid this movement. This movement of getting into the car is what ends up shearing a lot of people's pubic bone and can cause a lot of continual pain. Cool. Okay, getting in and out of bed. As I'm in bed, I'll talk about the sleeping postures there. So, grabbing all my materials. You can see the bed there. All right. So head is supported. When you get in the bed, you'll be here. You want to go right on your side. So you're here and shh. I do the shh to help activate my TA. That can be a little trick that you try at home too. If you have a hard time like wondering if you're activating it, if you do a shh, SH sound, shh, you'll feel that muscle contract. So my head's going to be here. You'll have something between your knees, or you can use a body pillow. If you have a C-shaped body pillow or a U-shaped body pillow, you maybe want the like thick part, not under your neck, but at the bottom of your body. Because you want your neck in line with your spine. Because the joints are more loosey-goosey, it's really important that the whole spine is aligned when you sleep and that you're not like sleeping with your like neck way up here, because that's going to cause neck pain, and that you're not sleeping in a rotated position because that's going to put more stress on your back. Or if you don't sleep with anything between your knees, that's going to put more force on your low back because your knees are coming together. It puts a rotational force on your SI and your low back, which can cause pain in the back. So you want your body in this nice aligned posture. You also want to like hug something. So having the body pillow is nice so you don't have so many pillows. And this is going to prevent that rotation up top. If you're someone who likes to go backwards, stick a pillow behind you. The whole goal of this is to support your spine neutral in the neutral spine when you are sleeping. So you avoid those forces that you could wake up with more pain or cause any other issues in your body. I'm going to use this too. Another good thing to always do is to stick a pillow underneath belly. So now my neck is not supported when I'm borrowing this, but you're going to stick something under the belly, and that's going to prevent you from rolling forward, and it's going to take the pressure off the back, the pressure that comes from the belly pulling on that low back. So as I get out of bed, I'll dish my props, and then I'm going to bring this arm up, exhale, drop my feet over, and come up like this on my side. So you're avoiding going backwards like this. So you don't want to split. So if I'm going to reverse crunch to the table, or if I'm going to lay back in a recliner, you don't want to have to work your body there, because that's going to put you susceptible splitting your abdominals. So keep the TA turned on and just go to your side and then come up. The reason I'm exhaling with the movement, so you can either do a sound to keep the TA on or just exhale, is because that's going to help take the pressure. Let's see here. That's going to help take the pressure off the abdominal wall and take the pressure off your back. So you can have, let's see, very relieving. Am I still there audio wise, Devin? Let's see. Okay, cool. Awesome. Okay, Haley, I missed your, at what stage in pregnancy should someone start doing this? And I think maybe that's in response to all the activity modifications. And I really say, like, as silly as this sounds, I say that you should start doing these modifications right away. The reason is just because a relaxin starts to affect the pelvis. So it starts to loosen up the pelvis at 6 weeks. And so you want to keep your body in line. You want to keep your core strong to really help prevent any of those aches and pains and dysfunctions in the pregnancy. The reason we want to avoid the SI pain, the pubic bone pain, is not only because like that's uncomfortable, but if our pelvis is out of alignment during pregnancy, it makes it really hard for the baby to just come through the birth canal. So the way the baby comes through the birth canal. So like if one hip is higher or our sacrums are rotated, which happen when we get dysfunction. So that's why it's also important, because we want to optimize our bodies for birth. Cool. Okay, so the importance of the pelvic floor. So let me just get to my favorite part, because I wish I had someone to do this for me for my first and second birth. I was working in a practice by myself during those first two children, and not a lot of PTs in the area will do pelvic floor work on a pregnant person, and which is slowly changing. We're breaking that mold because the benefits are so substantially amazing. So this is my first pregnancy that I'm actually having internal work done every single week, and it's making a huge difference from like just a physical perspective. But that was just a side note and a sales pitch, only because I'm going through it at the same time. I don't usually talk about that. But okay, so pelvic floor. Okay, so we have 3 layers of the pelvic floor, 3 layers of muscles. This is the first layer. This is the third. The second layer is invisible here. There's some on the back side of this, and it's also fascia. If you've had a C-section, these can get really tight. Any abdominal surgeries in the past, like appendix surgery or anything like that, your second layer oftentimes is the tightest. So it's also important to really address pelvic floor if you have any of those histories. But here's pelvic floor. It is just 3 layers of muscles. You have a vagina where the baby is going to come out. You have an anus where we have our bowel movements. You have a urethra where we urinate. You have a clitoris where we orgasm. It is, on this side note right now, because I just read an article 2 weeks ago about the importance of orgasm for uterine contraction. And so if you, it is really good to orgasm as a preparation for birth, because it's going to help not just keep your pelvic floor muscles active, keep the blood flow active down here, but it's also going to help your uterus in the prepping your uterus to stimulate some contractions. And it's totally safe to do through your entire pregnancy. So that was a fun article to read as a way to help prepare for birth. So orgasms are important, and it's important that if it is painful to have an orgasm, if it's impossible for you to have an orgasm, or painful, never like, or haven't been able to have one ever, that's like a sign of pelvic floor dysfunction, and we can definitely help you with that. As far as incontinence goes, so anything relating to the urine here. So if you're sneezing, peeing your pants, or just leaking throughout the day and you're not really sure when you're leaking, it is really common for you to have some issue inside the pelvic floor, and that can be treated during pregnancy, and it should be treated during pregnancy because that means that there's some dysfunction. And a lot of times it doesn't mean you're weak and you need to do more Kegels. It means that your pelvic floors might just be too tight, that it's not able to kink off the urine as the urine wants to come through. And as we have more pressure with the baby, there's pressure on the bladder. And so if your pelvic floor is already so tight that it's like squeezing to the max, it's not going to squeeze anymore. And those are pelvic floors that, how is a baby going to get out of a vagina that's like already so squeezed? So those are just some considerations. So that is incontinence. And so intercourse. So if intercourse is uncomfortable, so penetration, so vaginal penetration is uncomfortable, whether that's at initial insertion or with like deeper thrusting, or you feel like your partner's hitting something, that's often a sign that your pelvic floor is really tight. We hear all the time that like people are scared to have sex during pregnancy because they feel like their partner's hitting something. And I never once is it usually the cervix. Usually we can reproduce that sensation just by touching some of these muscles. So this is just a side note. I'm going to come to the chat in just a second as we go through. So if intercourse is uncomfortable, definitely a time to get pelvic PT. Any even if you are asymptomatic and you think that like everything's perfect, I never leaked pee in my life, I'm able to orgasm, sex feels great. That's all really good stuff. And you should still get an evaluation just to see what's happening in your pelvic floor. So you know that you can contract your pelvic floor, relax your pelvic floor, and bulge your pelvic floor. Those are the three positions that are essential. Bulging is the most essential because that's what's going to help you be able to push this baby out. But like I said, most people, especially pregnant, live in this state of a contraction. And so there's that. But I'm going to keep going with the pelvic floor and I'll come back to the rest of the bullet points here. So the other part that comes through the pelvic floor is the anus. So if you're experiencing any hemorrhoids, anal fissures, constipation, all of this stuff can be affected by the pelvic floor. So if your pelvic floor is really tight, it can affect, like when you're having a bowel movement, it can increase your potential to have a hemorrhoid or to have an anal fissure because the tightness isn't allowing you're not able to relax to get the poop out or the stool out. So just a couple things to say, like those are very common, and most people are sitting here saying like, oh yeah, experiencing something like that, and it's just extremely common, but it shouldn't be your normal. And so if you address it now before you have the baby, there's just so much that can change and happen to improve your pelvic floor health and prevent those symptoms from happening. And obviously, if you don't work on them before pregnancy, they're probably just going to get worse postpartum. And I don't mean to say that negatively, but usually because of the opening that happens with the baby, there's a substantial recovery that needs to happen within not just inside the pelvis, but on the outside of the pelvis to help bring everything back together. And even if you feel like you might have friends that they're like, I'm totally normal, I'm fine after babies, and that's great. But what happens is like 10 years after that or 15 years after that, the body stops compensating. So usually because childbirth is an injury, technically, I mean, there's massive amounts of strain that happen in these muscles. And if your body's not used to that, you can get tearing and you can get more straining or pelvic organ prolapse. And the body then can compensate beautifully for a long time to prevent leaking, prevent other issues that can happen, painful menstruation and things like that. But if you address that, like you might not even have to experience that. That's what I'm trying to say is pelvic floor prenatally can just be so preventative. So anyways, I'm going to come to the chat for a second before we go into a little bit more of some pelvic floor exercises. So let's see here. Is there a posture to help glute cramps? The pillow hasn't been helping. Yeah, it just depends on where the cramps are coming from. So with glute cramps themselves, it can be coming from your lumbar spine, or it can just be coming from your pelvis in general. So depending, you want to make sure that if you are cramping, it depends what posture you are cramping in. It sounds like maybe on your side. A good thing to do with that during, if it's when you're laying down before you go to bed, you can take a ball, a lacrosse ball is what we use, and put it against the wall and rub your butt against the wall. And that is one of my favorite techniques to help open up some of these muscles on the outside of your pelvis. Those are really important when you open those up to helping the whole pelvis open up. If your glutes are tight though, your pelvic floor is going to be tight. So if your butt is spasming, your pelvic floor is probably in the same kind of spasm. So it's a good idea to get all that checked out. Okay. Yes, you'll get a recording of this. Definitely. And yes, sleep every single night until I'm so sorry. Yeah, so a couple things with for Evan is with activation of the transverse abdominis, that can be preventative for straining, for some of the impingement that can happen at the lumbar spine in the nerves in the low back. And so as long as you are activating that transverse abdominis, I would say before bed, and this is for everybody on here, whether you have butt spasms, low back pain, nerve pain of any kind, sciatic pain, if you do 10 seconds of that transverse abdominis contraction 10 times every single night before you go to bed, that can help give you some relief and give you like kind of unload the nerves is what it is. So that is my favorite exercise as far as really helping protect that. Yeah, and I'm assuming that stretching isn't helping these muscles either. So cool. Okay, I'm going to come to the pelvic floor a little bit more. So I wrote on here because this is what the research says. So I'm just giving you the research on this slide, but I'm going to be completely honest. Clinically, this is not what I see. This is not what I give people because it doesn't work. Because really the importance is the magic that happens when you learn how to open up your pelvic area, your pelvic floor, your vagina, your anus. When you can get in touch with opening these muscles, it is so much more powerful. And I will tell you, even postpartum, I hardly ever start anyone on a contraction, a pelvic floor contraction, because usually I can get that to happen naturally for anyone, anytime. What I cannot get to happen is the relaxation. And really, as long as you have the relaxation, everything else follows. So so what the research says is when you're preparing for a birth, the contracting 10 seconds, relaxing for 2 seconds, doing that 10 times can help prep your pelvic floor. And then doing quick flicks is what they call them. 2-second hold, 2-second relaxation, 10 times. And I will be completely honest, it's not even, that is what the research says. That might be what, if you go to another PT, they're going to train you to do pelvic floor contractions. And to me, that's kind of BS, because what we need to do is we need to open up this area in order for the baby to come out. So a couple things. When you are on a couple slides ago, I talked about the diaphragmatic breathing being really important for birth. Hopefully I'm not getting too much feedback from the room next door. Devin, are we okay here? Okay, cool. Thank you. Okay, so if you want to put your hands on your belly, you're going to touch belly. You're going to breathe into belly and exhale. Now we're going to pair the pelvic floor with this. If you're sitting on a hard surface, you might be able to feel this in your anus or feel this in your vagina. I'm going to use anus and have you try to connect to your anus, because most people have better connection to anus than they do vagina. So I'm going to say anus, and I might throw in some vagina there too, or some labia. So labia, right, are here. This whole thing is a vulva, and anus is back here where the poop comes out of. So, okay, putting hands on belly. Gonna deep breath in. And what I should feel happening is I should feel my anus open. I should feel my sit bones want to come apart. And so I should feel my vagina opening and my labia opening. Okay. You might have to at home go ahead and put a finger either right inside your vaginal canal, or you can put, or you can just like kind of touch the labia. If you're not comfortable with that, you can just touch the labia and see if you feel a movement when you do a deep breath in, and you want to feel the opening. So you want to feel it go down to the floor. If that's hard for you to feel, you can gently squeeze to see if you can relax. But the magic happens when you can breathe, deep breath into belly, and pelvic floor opens and relaxes. Anus opens and relaxes. On the exhale, you get a natural recoil of your pelvic floor. On the inhale, you get an opening of your pelvic floor. Okay, so those are the positions of the pelvic floor. So when you start thinking about training your pelvic floor, this is what you want to be thinking of. Even if you're training it, sometimes what happens is that your pelvic floor is tight. Maybe you were an athlete growing up. A lot of female athletes we see tend to have really tight pelvic floors. And so then have harder deliveries. And then people who have extreme flexibility also have very tight pelvic floors because their pelvic floors have been working really hard to protect their joints. So with our tight pelvic floors, a lot of times it's this third layer that is so tight that even though you're able to relax it some, it doesn't mean that you're able to like get enough opening. So that's why it's important to get an assessment. So stretching this third layer, opening this third layer is something that a pelvic expert PT would do for you. I don't necessarily teach that for home because what we don't do is what we don't want to do is we don't want to touch the cervix. We don't want to come by the cervix, just for reasons of, not stimulating any uterine contractions. So I feel like I'm doing the opposite. When I breathe and my lower abs engage and I feel everything tighten. Yes, Alyssa, this is great. Thank you for sharing. That is a lot of times what people feel and what is happening in their pattern. And that's why it's good to get an evaluation so you can make sure you can change that pattern. So yes, hopefully you can memorize what we just talked about and see if you can change your mechanics there. But then for a lot of people, it's like opening past where they naturally open. You'll see a lot of people, your OBs, your midwives, they might tell you to work on some perineal stretching. That is in this first layer. And although that can be good and should happen, it doesn't compare to opening up your whole pelvic floor, because the babies, like a lot of times when we feel a tight pelvic floor, from my perspective, when we're doing an exam, if I enter the vagina, this would be the first layer. A lot of times I have to go up to get to the third layer and help it start to come down. Okay. So what you want to have happen is you want this entrance to be all on the same level. So when the baby comes out, it's just a straight shoot for the baby. And same thing with intercourse. So when a penis goes inside or any object goes inside, it is you're not hitting something right away and you don't have to go up and in to get in. You want this to be a straight shoot. That's a healthy pelvic floor. And hopefully that makes sense. So cool. Oops, let me come back here. So I'm just going to brief on the one time that it is okay to do Kegels during pregnancy and when you should feel like you can contract your pelvic floor is with coughing. So like if you're going to cough, you want to naturally squeeze and maybe TA as well. And then do it. And then you want to sneeze. Then you want to contract when you sneeze. So just making sure you have that. Those are the two times that it is important to get the contraction. However, if you can't contract your pelvic floor, you don't feel a Kegel at all, and you don't feel the relaxation, it's impossible to be able to do that before you do these movements. So definitely get in touch with learning how to use it. Feel, like I said earlier, you might have to like lay in your bed and or wherever you want, and kind of touch, see what's happening when you do a contraction, see what's happening when you breathe, and see what you can learn how to coordinate yourself. And then this is obviously what we teach people to do too. So, and we love to do that. So again, this is just a top-down look. This is the third layer of the pelvic floor, and where we see a lot of tightness, where oftentimes, we work with a lot of people who've had VBACs, who maybe had, or who want to have a VBAC. So that's a vaginal delivery after a cesarean. And a lot of times they'll say like the baby was almost coming down the birth canal, but just got stuck, or like couldn't come all the way out. And they didn't have a reason for it. And a lot of times it's like that third layer. The baby just doesn't have a straight chute through the pelvic floor. So it's why it's important to do that, to help decrease the risk of C-section. So cool. Okay, so I'm going to talk about how to have a healthy, happy bowel movement here. Let's see if I can move that out of my way so I can make sure that's what this says on the screen. Yes. And then we'll talk a little bit about how to push as well. And if you want more information, but you don't feel like you can come to the clinic or anything like that, we do virtual visits. And then we also have an online program as well that teaches a lot of this stuff that I'm giving you today. And a little bit more specific as well. Okay, let's see if I can get there. Okay, so you're just seeing me here. Hopefully you can still see me. If this is my toilet, so I'm sitting on my toilet here. Okay, what you want to do when you have a bowel movement, and it's extremely, I'm going to side note, it's extremely important that you aren't pushing when you have a bowel movement, because you don't want to cause a hemorrhoid, anal tears, or anal fissures, and really prevent a prolapse, so the organs from coming out. So this is why this is important. So in a seated position, if a squatty potty is comfortable for your body, you can definitely use a squatty potty. So what the squatty potty is doing that you can mimic by just simply leaning forward is it's taking this is called your anorectal angle, and it's just taking that and it's straightening the chute. So when you're kind of slouching forward and leaning forward, it's straightening the chute of the colon to be able to let the stool come through the rectum. We're all about straightening chutes here, apparently. Because that's what we want the pelvic floor to do, is just open up and make it one level of entrance and then or exit. And same with the colon. So here you're in this position. You're going to take a deep breath into belly. So one, you're going to use that breath. This is why the breathing is so important. You're going to use that breath 3 times. So 2, and then 3. On that third breath, you're going to gently bear down like you're trying to fart, but you don't want anybody to see you. So this is where the opening comes in. So 3 breaths, and then gently bear down like you're trying to fart, but no one can see you doing this. So it's not a strain whatsoever. The reason you're doing this breath also is because the breath, the diaphragm descending, okay, so diaphragm going into belly, is helping stimulate the peristalsis. So the poop, as the poop comes through your colon, I guess I'm looking reverse on the screen, but the poop comes through that left side and then down. This is my left side. And so you're using the diaphragm to help get the poop out, and to help, like you probably got an urge to have a poop, you go to the bathroom, and then you're going to use this breath. It's so easy, especially as moms, to just go to the bathroom and get it done and like strain it out. And you don't want to do that. This is lifelong. This isn't just pregnancy. And so sit, do 3 breaths, and then gently try and fart. So it's a bearing down. This is the opening. And if you don't feel like you have that opening, definitely see somebody that can help you get that opening, which we can do here. And so that's the first thing. You want to start to poop like this every single day. So if you're not having bowel movements every day, that's something that you want to work towards. So improve the consistency of your stool, hydration, exercise, whatever that is for you. And then you want to try and get to a point where you're having bowel movements every day. It's going to help decrease the pressure in the abdominal wall. And that's just healthy mechanics. So constipation isn't diagnosed until you're not having bowel movements every 4 days, but healthy transit is having a bowel movement every day. Okay, so that was my side note. Then I'm going to bring this to pushing. Okay, so In the same, I'm going to talk about labor for a second. How am I on time? Good. I have about 10 minutes left. But I'm just going to talk about laboring for a second. And if you have a chance, I would highly recommend that you listen to my podcast I just did a couple weeks ago. I don't even remember what it's called. Devin, maybe you can throw that in the chart. But it's a whole birth meditation podcast. And I talk about the anatomy of what's happening and how you can start to visualize this when you're laboring, and how you can incorporate this into pushing as well. So when you're laboring, you're using this type of breathing. So into belly, exhaling to help bring diaphragm down into belly. It will help make the contractions less painful because you're stimulating what we call your parasympathetic nervous system, which is that rest and digest place. And that's really important to stay in that place when you're in labor, because your body's not going to have a baby if you're in that sympathetic, like heightened, like alert, scared state. If a tiger was chasing you through a forest, you would not have a baby. And that is what our sympathetic nervous system is when it's on fire, or like when it's activated. So we want to work on keeping our bodies in this parasympathetic state. So doing this abdominal breathing during labor itself can be extremely beneficial at keeping your body relaxed, keeping you in a state of relaxation. And then it's also good because you're using your diaphragm to push on the top of the uterus, which is going to help open the cervix. So that's the point of, or that's what's happening right during labor, is you're starting to dilate. And so you're using your breath to help push on the top of the uterus during your contractions, especially. Does that make sense? Hopefully. So when we start to talk about the pushing phase, so when we get to pushing, obviously pelvic floor has to open, right? So we want to make sure that we have this motion beforehand. And it's important to know that because it's like training for a marathon. If you go run a marathon and you've never ran, in your life, you are going to have an injury. And so same thing with childbirth. If you don't know how to get your pelvic floor to this point, or you haven't been getting your pelvic floor to this point, most likely we'll end up with some kind of injury. And that's why this should be standard care for everyone everywhere in the world. But that's a story for another day. So what's happening with pushing, I'll eventually get there, I promise, is when you inhale, so you inhale and then exhale. So inhale, pelvic floor, vagina is opening, anus is opening, and exhale. When you'll start the push is at the top of the inhale. So you inhale, and then you're going to start to push, but you're not holding your breath. You start the push at the top of the inhale when you begin to exhale. So I'll let you sit with that. So inhale, pelvic floor is opening. I'm feeling my pelvic floor open. And instead of it recoiling like it does naturally with the exhale, I'm initiating a push and opening on the exhale. So inhale, open pelvic floor. Exhale, start to push through pelvic floor, bear down through pelvic floor, and bear down like you're trying to fart or poop. And this is so does that make sense? Anyone with me on this? Cool. So that is pushing mechanics. I go a little bit more deep into that with the birth meditation podcast, and I'm going to let you guys listen to that if you're interested, and we go even deeper into that with our online birth prep program. Cool. Okie dokie. Let's go on to the next thing. So how to prevent tearing. Really, it's all about pelvic floor prep. It's not about Kegels. This is about opening. You guys have heard me say this for the last hour. And that's why it's just so important that you see an expert pelvic PT who's going to really know what needs to happen for birth prep and for optimal birth delivery, or for optimal pelvic floor health for delivery. So it's really exciting. I mean, most people we see prenatally, there's been maybe 2 emergency C-sections that we've had in the last year. Like most people that come here have vaginal deliveries. This needs to be the way of the future. America right now, we have 30% cesarean rates, which are just really high. So there's a lot that you can do to prepare your body so you don't have to be that statistic. And there, of course, there's emergency situations that you have to get the baby out no matter what, and that's what cesarean is there for. But it shouldn't be because of any, the baby's just not coming out, or starting to the baby's decelerating, their heart rate is decelerating because the baby can't get out. So that's where this is just like, if we can start to optimize our bodies for birth and go through some of this, even you just being here today and like starting to incorporate the breathing, the opening, connecting to your pelvic floor, it's going to make a huge difference in your ability to be prepared for birth. Cool. Okay. I guess I'm going quick on I can't see what it says. So I think it's like daily rituals and exercises or something like that. But so really any of these exercises, whether it's Pilates, yoga, boot camp, bar, whatever that is, they tend to be fairly safe as long as you are working with keeping your core active. If your transverse abdominis is engaged when you're in a certain yoga position, that's going to prevent you from overstretching. Now, if you're trying to get deep into poses with your increased flexibility in your joints, that can cause injury. So that's why being able to activate that transverse abdominis is so essential in preventing any tearing, and especially essential in preventing diastasis. CrossFit, lifting heavy weights, that's totally safe, especially, if you were doing that before you conceived, definitely safe. You just want to know what your breath patterns are when you're doing those heavy liftings, so you're not pushing your organs out of your body, and causing a prolapse, which is definitely what we see a lot of times. So that would be something that you'd want to kind of have checked out for you, depending on what kind of exercises you're into. So I obviously wrote this a long time ago, and prenatal yoga was like very trendy. So I don't know. I feel like that's not as trendy anymore as it was when I wrote this, but cool. And the best thing you can do for yourself is definitely like find your pelvic expert PT. That's just going to spend a lot of time helping you not just open up your pelvic floor, but open up your entire pelvis and keep you stable at the same time. And what this does for healing is just exponential. Earlier, I talked about doing a glute release with the lacrosse ball. I love that. And then you can also use it on your feet. Yeah, perfect. I'm going to just keep going here. Good. So immediately postpartum, it's important that you know how to use your core. If you come for a discovery visit, though, we will send you this book so you will know how to use your core postpartum. But especially like if you have this connection prenatally, you're going to be set postpartum. So if you can initially postpartum, a lot of times we will have people like do a couple pelvic floor contractions. It's really, really specific for certain people. But let me say this, with everyone that we see 6 weeks postpartum, if we haven't been seeing them during pregnancy, we never, ever, ever start them on a Kegel. And that's because they are usually tight and bound with scar tissue, or because they are tight and bound because their pelvic floor is trying to pull their pelvis back together after being separated so substantially at birth. So doing a Kegel like as like a return to exercise is just, to me, kind of not appropriate. And there's a lot of other things that you can do. So I'm saying Kegel because that is trendy, like, right? And so hopefully you'll get from this that like it's not about the Kegel at all. It's about the opening, the breathing, the pelvic floor. And then if you learn how to use your TA, that will help pick up the pelvic floor when it's appropriate, meaning it will help the pelvic floor contract when it's appropriate. Cool. Postpartum, just some things to note is most providers aren't going to check your whole entire abdominal wall. So they're not going to check from your sternum to your pubic bone if you've had a diastasis or not. And they won't check your bladder, your rectum, your anus for any, your like uterus for any pelvic descent. So any prolapse. So it is really important to get a checkup postpartum before you start returning to exercise. So you don't just like throw your body into something and start to develop different compensations, because those compensations might keep you pretty good for a year to And then say if you have another baby or multiple babies, those compensations don't last very long. The more babies we have and the more problems that can cause. So just really important to get clearance not clearance even, get some help postpartum. Just know where your organs are at, know where your belly is at, and go from there. Cool. So just some things that we help with. If you're having any of these, leaking urine, pelvic pain, back pain, any of it, I would say like you should definitely get a pelvic expert physical therapist to take a look at you. But really anything like as far as like prepping your pelvic floor, you just need to know where it's at. So cool. As far as like pelvic PT as well, it's really, if you decide not to come here, you want to find someone that's really going to look at all these muscles specifically inside the pelvis, especially that third layer. And that is harder to find during pregnancy and postpartum for that matter, because a lot of people aren't taught this stuff. So it's just a side note. If it's not possible to come here, definitely check out this birth prep meditation, check out our program, our online program, and then we do telehealth visits to help you train yourself as well. So cool, just some health advice information. Any questions here? I would love to answer some. I tried to touch on the questions that came in from everybody. I got a lot going on over here, but if you have questions, please pop them into the chart. I'd love to answer them, or you can come on and ask if you'd like. We can edit this part out of our recording as well, I believe, Devin. I don't actually know that, right? Yeah, we can. Okay. Okay. Let's see. Oh, awesome. Cool. I'm glad. Yeah. Oh, Evan, I had a subchorionic hematoma with my second. Yeah. And it just depends on how much bleeding you're having, if you're having bleeding at all. These are extremely common because ultrasound has gotten so much better. They pick this up all the time now. So it just depends how much it is. And sometimes they can be massive, sometimes they can be small. Yeah. It's not a contraindication for pelvic therapy. So just so you know that. Anything that can be done to prevent pelvic or coccyx fracture, does that play a role in pelvic floor health? Yes, I'm so glad you asked. Absolutely. So no one should have a coccyx fracture, simply because like if these muscles, so this is your third layer that you're looking at in the pelvic floor, if these muscles are loose and opened up, so we do this all intravaginally in our clinic, and we can do some externally. We do a lot externally as well. But if that doesn't work for you, we can also do interrectal if you have had a history of coccyx pain in general. But the coccyx, it depends. It moves different amounts in different people, and it should move. So the reason people will get coccyx fractures is because the pelvic floors are so tight that there's no room for the baby to go, and the baby just busts through and causes some kind of fracture either in the sacrum or in the coccyx. And yeah, in my opinion, that's extremely preventable because the more movement you have in the muscles, the more flexibility you have, the less stress and strain on the bones and the joints. So yeah, we don't accept insurance, especially for prenatal prep stuff. Because it's considered a prevention, insurance won't pay for that. We do offer super bills, so you can give that to your insurance as far as for getting reimbursed. And a lot of people do that is you pay out of network or you pay out of pocket and then you submit to your insurance. And because we don't supply the notes, they don't know usually there's something we can add to the note to help you get reimbursed, like whether that's you're having some kind of back pain, incontinence, or something like that. But for just like standard prenatal prep, that doesn't get covered by insurance. I hope that answers your question. If you've already had a coccyx fracture, can you still prevent it with birth? I would need to look at some specific research if there is any. I've never heard of someone having multiple coccyx fractures with multiple births. I'm trying to think. No. And I would say it's fairly rare, coccyx fracture with birth. Coccyx dislocation is more common. But definitely like, I agree, like still can definitely be prevented. Yes, and we accept those. Oh, that's Devin. Devin saying that. Cool. Any other questions? Happy to like answer anything. You can email us. We'll send the replay too, and any questions you have. But I would definitely like come in for a discovery visit. We send you a free copy of my book, so just come for that alone. So then you'll have some guide postpartum too. But really, it's just great to be able to like specifically find out more about like what you're wanting for your delivery, whether that's like you really want to have a, you know, no intervention birth, or you want to have an epidural and be able to still like not tear and all that stuff. We can definitely like help you with whatever plan you have set for yourself, and it is totally okay to have a plan. Even though most people are like, a lot of people will say like, try not to have a plan so you aren't disappointed. It's all about having a plan. We 100% believe in having a plan, and we create that with you. That's part of what we do with our prenatal packages is we make sure that like you have some clear vision of where you want this birth to go, so your body knows where this birth should go, and we just help get you there. So, oh, Devin, can you drop that discovery visit thing in there? Cool. Great. Thank you so much. Awesome. Thanks for joining, Mallory. Thank you all for joining. This was a lot of fun. Happy Friday. Happy weekend. Since we're not going out for happy hour, or maybe you are, but just with virgin drinks. Okay. Cool. Awesome. Great. I'm so glad you guys enjoyed. Thank you. Thank you. So much fun. Have a good night, everybody.